So apparently oxalates can come out of your lungs, and in fact, it's very common that when you have oxalate poisoning, which many people do, that actually you shed oxalates out of your lungs. And of course, these are little crystals that irritate your lungs and cause you to cough. And this can predispose you to getting a cold or a respiratory infection. And this is fascinating. I was listening to Monique Attinger, who calls herself Low Oxalate Coach, and she said that if you have a cold or like a respiratory issue, she said you should try treating it as an oxalate issue, because she said chances are you might be just shedding oxalates out of your lung tissue. And how do you treat oxalate issues? Well, you give yourself minerals. You give yourself magnesium, or other minerals, potassium, citrate, etc., um, sodium. But this, I tried this. Actually, my son was having a cough, and I thought, well, I'm just going to give him a bunch of magnesium. And I gave him some topical magnesium just on his skin. I gave him the magnesium chloride drops all over his skin, and it actually helped, and his cough like went away. And so I found that fascinating because it's very simple advice that Monique gave. She said, when you're dealing with a cold or a respiratory issue, treat it like it's an oxalate issue. And so that means you give minerals, you give magnesium or other minerals. And I think that's really good advice. And going forward, I will take that advice. I think most people don't realize that many colds and respiratory issues are caused by oxalate shedding.